Dr. Deena Adimoolam, welcome to ITV Goals. Thank you so much for giving us your time today.
Thank you for having me, Aditi.
Lots of questions for you, so let's go right into it. My first question to you has to be about the cases and deaths in the nation right now. We're looking at more than 800,000 deaths in the nation with at least 50 million cases. My question to you is, why is this happening and what are you observing while you are treating patients?
So we do believe that this surge is expected after having had Thanksgiving together with many families coming together in certain areas. And we are also seeing a rise in areas as we had expected, where we have a lot of unvaccinated populations.
Right. And then let's now talk about what is also causing the surge of cases, the news that is coming in today. We're hearing that the new variant, the Omicron variant of the coronavirus, is causing and doubling the number of cases every 2 days. How are you looking at Omicron's arrival into the United States, and what is it going to do to the cases and numbers of deaths?
So as you know, currently in the United States, Delta variant is still the specific variant that's causing the most number of hospitalizations and cases. So this is still a pandemic of the Delta variant being the predominant strain. We know that Omicron has made its exposure here in the United States, but we haven't really seen that significant number of cases yet. We know that it may potentially rise as we look at data that is coming out of South Africa, where the Omicron variant is the predominant strain, and there's an increase in the number of cases related to that variant. But we just don't have enough information yet to know how Omicron is going to affect our US population here.
The EU is saying that Omicron will become a dominant variant in the next coming months. In the UK, it's already getting to that level. So is it just time, doctor, before we see the same trend or trajectory of cases here with Omicron?
So I think only time is going to tell, Aditi. We really don't know. We can't really compare ourselves to other populations. So we're going to have to see what exactly happens in the United States. If you look at the vaccination rates in areas like South Africa compared to the United States, the vaccine rates in South Africa are 20 to 30%, which is much less than what they are here. So it's important to sort of keep that in mind when we're looking at the populations and the trajectories that we are alluding to in other countries. However, if the Omicron variant becomes as significant as it is in countries like the UK, similar to what we might expect in other areas in Europe where they have similar vaccination rates in the United States, it's going to be very important to make sure that we're doing everything to be cautionary in terms of protecting ourselves against this.
Right now, when looking at this country, what areas are you most concerned about as we go into the months of winter?
So we have a lot of data coming out of certain states like Michigan, for example, where there's been a lot of recent hospitalizations. Hospitals are talking about how they are understaffed, some of them, how they're concerned about bed shortages. So some of the situations similar to what we were seeing last year at this time in different areas around the country are being seen in places like Michigan. And talking to colleagues there, people are also concerned about, what this means for people who are coming into the hospital for other reasons, like a motor vehicle accident or for a heart attack, for example. So it's very important to look at those populations, to do the best that you can if you're living in those states where there's a lot of people getting infected with COVID right now, and do everything that you can to be safe. So the main places I'm concerned about at this moment, just looking at the data this morning, is Michigan, Indiana, and Ohio. And of course, I'm still concerned about the areas where vaccination rates are less than 55% in the country, as well as becoming potential hotspots, especially after the holiday get-togethers.
Let's talk about the vaccine, doctor, a little bit. We are trying to push vaccinations across the country. The Biden administration is doing the same thing. There's also a push for booster doses to get more booster doses into the arms of Americans. Now, if you look at it in a strategic manner, what needs to be the focus right now? What will get us through this pandemic a little bit better? Is it focusing on the booster or getting more of the first doses into the arms of Americans?
So I think it's important to remember that you'll only qualify for a booster after you've received the initial vaccination. So I think that the focus should be on getting as many individuals vaccinated as possible. People who are above the age of 5 years and older, unless there's a contraindication, can all qualify for getting a COVID-19 vaccine. We have a lot of data to suggest that it's safe and effective. And we also know that the booster is extremely important at this time as well. It improves your ability to fight off COVID-19 infection. It improves your antibodies significantly, sometimes up to 40 times more antibodies after receiving the booster vaccination. So if you're 16 to 17 years old and you've gotten the Pfizer vaccination in the past, then you can maybe qualify for the Pfizer booster vaccine. And if you're 18 and over, you can qualify for any of the booster vaccinations. So please consider getting boosted and vaccinated.
And when we are looking at South Asians at high risk, and a lot of South Asians have a lot of comorbidities that really impact the immune system, how important is it for them to get the booster dose?
It's extremely important to consider getting the booster dose, especially if you're high risk. As you know, many South Asians are living with underlying medical conditions like diabetes and heart disease, which really put them at risk for potentially having severe COVID-19 infection or even dying of COVID-19. So we have this really effective and powerful tool to help prevent hospitalization deaths in the form of a vaccination. So it's extremely important to consider getting vaccinated to prevent death or severe infection.
And vaccines.gov is the website where people can go and find information. News coming from South Africa on this Omicron variant, doctor, and the vaccine efficacy. They're saying that 2 doses of Pfizer may not be enough to protect against Omicron. And they're also saying that the booster will add additional protection. How are you looking at that? And are these vaccines going to be eventually effective against Omicron? I think that's my question, yeah.
So we have some preliminary data that's come out of South Africa. The first thing that is important to remember is that this is lab data. So they're actually using the serum of individuals and looking whether or not they are having antibody responses to the booster and the vaccine. This hasn't been looked at in the real world population yet, but those studies are sort of ongoing now. But we can sort of extrapolate information from looking at this laboratory data to say that it looks as if the booster dose, the Pfizer booster dose at least, provides us with some additional protection against the Omicron variant. It looks like those that had, in the sera, from what they can see from those that had received a booster dose, there's a 25-fold increase in the antibodies against the Omicron variant. And this wasn't so substantial when they looked at the sera and those that just received the Pfizer 2-dose vaccination series. It's also important to note that they believe there's still that 95% protection against severe hospitalization and death from the Omicron variant when you have received the Pfizer booster shot. So this is all really reassuring. It makes me more compelled to tell my patients that they need to get the booster vaccine because we know then that there's some more possibility for protection against the Omicron variant that you would get from just having had just 2 doses of the vaccine in the preliminary series.
Doctor, why is this Omicron variant more transmissible? The CDC director, Dr. Rochelle Walensky, actually stated that today, that it's more transmissible and will become, a greater concern in the next coming weeks. Why is it so transmissible?
So it appears that there are certain mutations of the Omicron variant that make it more transmissible. It has certain features that are similar to the Delta variant, which made the Delta variant more transmissible, in addition to some other mutations that are a little bit more concerning. This is why it's a variant of concern. It seems, again, that we have to extrapolate a lot of data from other countries of what's going on, but it appears in areas like South Africa, for example, there's a significant transmission that's happening right now with a significant number of cases just over the past 1 month.
Yeah, so again, we are discussing the importance of vaccine on the show today and the booster dose. This brings me to $1 million question that everybody is always asking in regards to vaccines. Are we going to have to take a vaccine every 6 to 7 months? Because that is what the trend seems to be like.
I think we just, at this time, there's just not enough data to know exactly how the frequency of this dosing will be. I think that a lot of health experts are believing that there's probably going to be at least a yearly dosing of vaccination similar to the flu vaccine, just to keep up with the number of variants that exist in the population. But of course, only time will tell. As more and more people get vaccinated, there's a possibility for less mutants and less variants to be created. And if that occurs, then maybe we might have enough protection from the vaccine on hand to not necessarily need to have such frequency in dosing.
But this virus can mutate.
Yes.
It's possible that can happen again.
Yes, and that's what we're seeing with the variants of concern.
Right. So that's why it's important, again, to get the booster dose. Let's now talk about vaccines amongst children. Doctor, it's a big question of concern for parents all across the nation. We're seeing slightly low rates of vaccinations amongst children, especially from the age group of 5 to 11. There's a lot of misinformation about the vaccine also given. Now, how do you address it to the parents? And there is a risk of the heart inflammation as a side effect from the COVID-19 vaccine in children. How are you addressing that?
So I'm a mother myself, and I have 2 young children that are under the age of 5. They can't get vaccinated, but I have always been, a real advocate for this vaccination, especially when you follow the data. So there is data that many people can even look into, looking at these populations of children that have been studied in these clinical trials, and there's tens of thousands of kids that have been given this vaccination to show that it is safe and it is effective. The heart inflammation that you're alluding to is a condition called inflammation around the heart, or pericarditis, myocarditis, and that is something that's extremely rare. We don't know if that's an actual side effect related to the vaccination versus a child potentially being predisposed to having one of those sort of symptoms previously. So it's hard to say that came because of the vaccination, but health experts believe that is not a side effect of the vaccine.
And the benefits outweigh the risk here when it comes to children. Would you say that?
Absolutely. I think that from the data that we're seeing, there's, kids do get infected with COVID-19 as well as adults. Yes, they are at less risk of hospitalizations and death, but we do need to protect these young children as well. There's always a potential that there may be complications from COVID related to children getting the infection. It is rare, but we don't know if that's going to be our child or not. So in my case, if I have the ability to protect my son and my daughter when the vaccine is available to them after they turn 5, I will consider getting it for them, because I just don't know if they could potentially have a severe complication of COVID if they got sick or even be hospitalized. So if I have a tool to help protect them against those things, right, I'm going to use that tool to my advantage.
And would you actually recommend pregnant women to get the vaccine? I know there's been a lot said about that as well.
Absolutely. I would recommend the vaccination in pregnancy. We do know that pregnancy puts women at an increased risk for developing severe COVID-19 infection, hospitalizations related to COVID-19. I actually got the vaccine when I was pregnant as well. And I got it at a time where there was actually even less data to support that it is safe and effective in pregnant populations. And I can tell you that I was able to have a normal delivery. My child is doing well. And I'm very excited to be able to also give my daughter some of the antibodies that I developed from having the vaccine through breastfeeding. I'm breastfeeding my daughter, and I know that there are many studies suggesting that there is benefit of the antibodies that are given in breast milk that may be transmitted to my daughter, giving her some protection as she's only 6 months old and has a very long time to wait to get that vaccine dose.
What's your biggest worry at this moment, doctor?
I think my biggest worry at this moment is definitely the states that are being hard hit right now by COVID infection, and hospitals becoming burdened with infections and less beds and less ability to treat people for things that are non-COVID related. I think that's my biggest concern at this time, to make sure that those places definitely have the help that's necessary, and to make sure that the people in these hotspots or these high-risk areas are also really trying to do everything they can to keep safe.
This brings me to another very important question, and we're seeing this come up everywhere in all the states, the need for masking, especially when the Omicron variant is spreading. What is your take on it? There are some states that are doing universal masking in indoor public spaces where vaccination statuses cannot be confirmed. Is this a wise decision? And your take on it?
I do believe that we do have some preventative measures that we know work. And if we can utilize those measures to help spread the COVID-19 infection overall, then why not? So masking is one of those things. All the social distancing measures that we've been talking about, maintaining 6 feet of distance, making sure that we're hand washing, making sure that we're wearing masks, they're all different measures that are implemented that will help decrease the spread of COVID-19. And we've seen that time and time again. But more than all these social distancing measures, most importantly, is making sure that you get vaccinated. Getting vaccinated and getting boosted if you qualify are going to be the best ways of protecting yourself against infection. In terms of wearing the mask, I think it's extremely important, especially as we enter into the holiday season. It's important to mask up if you're not vaccinated. It's important to mask up if you don't know the status of the people around you, whether or not they're vaccinated, whether or not they're traveled to a high-risk place, whether or not they may potentially even have COVID-19 at the time. And it's extremely important to just, make sure that you're doing everything to protect yourself and your family and be vigilant.
Yes, so important to be vigilant. I think that's like a very important aspect of making sure you don't get COVID-19. Another big question for you, and I only have 2 more questions left here for you. Pfizer is saying that its antiviral COVID-19 pill is about 90% effective. Great news. I know so far there is no antiviral pill that is being used for treatment of COVID-19. So please give us some insight into it, and do you think it can help save more lives?
So I think we only have real limited data right now that's come from Pfizer, but I do find that their data is extremely reassuring. To be able to have a pill to help people not be hospitalized or die from COVID-19 if they do get infected with the virus is definitely reassuring. So I look forward to seeing more of the data coming through these trials, and hopefully if it's available to the public, I think it will be great. Right now, the only treatment options that we have that are FDA approved or authorized are really injectables or IV medications that can be given in a healthcare setting. So people have to go to a hospital or they have to go to an actual healthcare facility where they're given something through the arm through an injection, versus a pill form makes a huge difference as well in terms of access for what people will be able to receive.
What's your take on getting monoclonal antibodies if you do get COVID-19?
I think it's extremely important to consider that, especially if you're a high-risk individual. So if you're high risk and you're concerned about your COVID-19 infection, I think it's really important to reach out to your doctor to find out where you can get monoclonal therapy and whether or not you qualify for it.
Yes, definitely. And my last question to you, doctor, I would like your prediction for this month and the next month as we go into the new year.
So I think I'm predicting that, we're going to see further surge in cases, unfortunately, just like we saw from Thanksgiving, people getting together and then cases on the rise. I think, we're going to see the same thing when people are getting together for the holiday season as well. I'm also a little bit nervous about Omicron. We don't really know too much about this variant yet. We have a very limited number of cases in the United States at this time. However, I'm nervous about the fact that Delta is so transmissible. It's still the predominant strain here in the United States. And if Omicron is just as transmissible as Delta or even more, we're going to see both types of variants being on the rise in our communities. It's going to be even more reason to make sure that we're doing everything to be safe. So for all those people that want to be safe, the best thing that you can do is really to consider getting vaccinated. Get vaccinated if you're age 5 and above with no contraindication, and get a booster shot if you qualify for Moderna, Pfizer, or J&J if you're 18 and over, and definitely for the Pfizer shot if you're 16 or 17 years of age and can qualify for a booster.
Definitely. Vaccines.gov, again, is the website, everyone. You can find information and you can also book your appointment there. Doctor, thank you so much for your time on ITV Gold today.
Thank you so much, Aditi. I appreciate it.